Hi, I'm Ralph Duckett with Caldwell Urology in association with UNC Hospital and Caldwell Memorial. I wanted to talk to you a little bit about vasectomy and, more importantly, what's called a no scalpel, no clip vasectomy. So most guys have either friends or family that have had a vasectomy. Most guys have fallen on a bike, been hit with a baseball, and they envision vasectomy as a miserable experience and the follow-up miserable as well. The biggest thing I want to do is allay those concerns. While I can't guarantee that everyone is simple, most everyone with vasectomy has a very pleasant experience. In situations of marriage, there's two options. There's tubal ligation, there's vasectomy. But if you look across the board, vasectomy is by far the simplest procedure with the least accumulated risk, by far the least expensive. There's not a close second. And then most importantly, is the single best long-term form of birth control. We're splitting hairs with tubal ligation, but it's kind of un-American. You get the best, the easiest for the least, and it just doesn't seem to work that way. But it does with a vasectomy. The procedure is done as an outpatient procedure in the office. In the situation where I do this, believe it or not, it's without sedation, so you can drive yourself to and from the office. And that's very important to note. You don't have to bring a wife and children in. You don't have to take significant time off for work. Very, very tiny punch incision in the front of the scrotum. There are two vases, but one incision. We take two segments out about 1 centimeter each, and then we cauterize or we burn both ends of both sides, so 4 endpoints. In most situations, a lot of people use clips to cause occlusion or blockage of the vas. There are studies that would suggest the clips may cause some type of breakage in the vas, and so think of clamping a PVC pipe and you get leakage around the clamp because it's broken it rather than sealing it. With cautery or burning those ends, it develops scar tissue. The reason I like this procedure is, one, I think it's best in terms of effectiveness. Number two, there's far less discomfort. You don't have the clamped vases. And then number three, you don't develop a knot or ball or firm spot in the scrotum where the clips are healed over time. So I think there's a great advantage to it. It's simpler for the patient. Again, tiny incision, no stitches, minimal bleeding risk, and then back to activity a bit sooner. So you may have heard of situations where there's 2 incisions, there are stitches. Those days are long gone. We do offer clips if people feel more comfortable with that, but I have not done it in quite a number of years because most patients are most comfortable with the no-clip technique. We check a semen analysis at 3 months, and at that juncture, if semen is clear, and 99% plus is, then you're good to go without protection. The two main things to understand with vasectomy: until we get a negative semen analysis, you have to continue protection. You are not sterile until we prove it with semen analysis. Lastly, with the no-clip technique, you do have to avoid ejaculation for 10 days because think of it like a wet cast. You have a wet cast, you walk on it, it doesn't work well. Well, the same with vasectomy. It can't be strained in that first 10 days to allow scar tissue to form so that you're getting the long-term protection you're wanting. If there are questions or concerns, you can reach out to us at 828-757-6510. That's Caldwell Urology. We're more than happy to see you, provide consultation, and perform vasectomy if needed. Thank you.